It's time now for Ask an Expert. Every weekday at this time on KCBS, we're giving you direct access to top experts in various fields. Today, as we've been reporting, hundreds of volunteers have been deployed in efforts to get a better picture of how many unhoused residents we have in the Bay Area. And for a closer look, we're joined live on the KCBS Ring Central Newsline by Marie Bernard, Executive Director at Sunnyvale Community Services. Thank you so much for being with us this morning.
Thank you, Margie.
Well, first of all, let's talk about Sunnyvale Community Services, what your organization does and how you are helping with this point-in-time count.
Well, thank you. Sunnyvale Community Services is the local safety net here. We're one of the 7 emergency assistance agencies across Santa Clara County that cover all the zip codes with basic needs services. And our mission is preventing homelessness and hunger here in our local community. And we've helped 11,300 of our neighbors last year with financial assistance, food assistance, and connections to services. But sadly, about 800 of the people we served last year were unhoused. So about 8% of the people that we serve. So though our mission is to prevent homelessness, we are often helping to address it. And today we are going out with a number of our sister agencies in the county to try to get a reasonable count, to get some data on the actual number of people who are unhoused here in Santa Clara County.
And how are you doing that? It's a coordinated effort, isn't it, with the county and then agencies like yours, and then I imagine a lot of volunteers as well.
Yes. Well, this is a national effort to count all of the people experiencing homelessness in every community, and we use surveys and observational counts on this. It's called the point-in-time count, and it's done in 1 or 2 days nationwide in order to get a pulse of the unhoused population here in our community. So today, just in Sunnyvale, our city of Sunnyvale is coordinating this, and we were the host of it. We had about 50 volunteers, a majority of whom are people with lived experience. That means that they have in the past been unhoused or they now are unhoused. And what was sad was this morning when I woke up at 4 o'clock in the morning, the temperature outside read 32 degrees. And some of these folks who showed up, they carpooled, they biked to our site in order to be volunteers today to help count the unhoused people in our local community. And so the volunteers today in our community were focused on Sunnyvale, and each of the communities are focusing on their areas. These are folks who know where their unhoused neighbors are staying, where they might congregate, where there might be a group of people who's sleeping outside, sleeping in their cars, sleeping in RVs, certainly not housed in a way that we all want to be.
Absolutely. And how wonderful that they're coming back and trying to help their fellow neighbors who are in the position they once were. You mentioned the different areas where you can find homeless people in all those different types of situations, sleeping in their cars. Is that the reason why it goes over 2 days? And do you have people looking at night as well as during the day?
Well, this is done actually for many years. It's usually been done in the morning. So Sunnyvale's doing it just today. So you usually pick a day to do the census tracts or the areas that you're going to be covering. And today was the day that we picked. So everybody's going out in one point in time to cover all this area and try to find every street and every area that we might be finding people who are unhoused.
And how do you tally it up?
Well, there is an application that's being used countywide, and in fact, it's based on some national data collection models as well. And the information is put into the system so that we are actually getting data. So it's direct data. It's either through observation or actually speaking to people who are themselves unhoused and get some information from that. And so it's quite a mix of real live data, and it's that point in time. So in a frozen point of time, how many people are out there that we can observe or encounter and count. So it's like a census that you would do, but it's actually during one day, so that you have a consistent methodology across the country of people trying to get a handle on how many people who are homeless and unhoused in our neighborhood are actually being counted.
So are you getting names, or are you just getting "Are you homeless? Yes, I am" tick?
Oh, it's all anonymous. So no, this is all not to collect the data on the individual. This is very much anonymous and really trying to get the raw data.
Earlier this month, there were some federal figures that were just stunning. Santa Clara County has the highest unhoused population of all 9 Bay Area counties. And of course, you have the largest population as well. Nearly 39,000 unhoused people live in the Bay Area, and more than 10,000 of them in Santa Clara County. What's going on here?
Well, it's all about the cost of living here. That's why our mission of prevention is so difficult, because people who are trying to make ends meet, working families, or people living on fixed income really struggle to stay here. And it's a challenge because it's not just a one-time assistance often that is needed, because people are chronically underwater where they don't have enough money with all that they earn to pay for the rent, to buy food, to pay for medical bills. And it's been very true for decades that people are one bill away from becoming unhoused. And sometimes, no matter how much help you can give people, it's not going to be enough unless some of the other equations move around. Like there's enough affordable housing, truly affordable housing, and enough quantity of that people can afford to live and work here. People who have been here for in some cases, generations, are now not able to thrive here because they just can't afford to live here. Everything is expensive here. And now with the cost of food going up, eggs are now $9 a dozen. It's really a perfect storm for a lot of people, and that's why the numbers are going up.
Marie, we're going to ask you to stay with us because there's so many more questions, especially at preventing homelessness, and we're going to ask you those questions after traffic. But we've got some slow spots this morning in the Bay Area. Here's Claire from your local Honda Dealers Traffic Center.
Yeah, we continue to struggle on the peninsula with 3 different crashes now. If you're on Interstate 280 getting into Woodside, southbound at Farm Hill, had a couple of lanes blocked. They did just clear it out of the way, but you're still jammed from Edgewood. It should be getting better shortly. But meanwhile, 101 southbound into Redwood City past Whipple Avenue, we also had a crash. That's still blocking the right lane. That's jammed from Holly Street. And if you're trying to get to SFO, there was a wreck on southbound 101 at Millbrae Avenue. They just got those folks to the right shoulder, but that's why traffic is so backed up from 380. Our next report is 9:38 on the traffic leader, KCBS.
Thank you, Claire. We do have another chilly morning, but a mild afternoon. A freeze warning in effect for the North Bay interior valleys and a frost advisory in effect for the remainder of the Bay Area until 10 this morning. Highs in the mid to upper 60s by the Bay and inland, around 60 at the coast. Tomorrow, similar to today, a chilly start and a warmer afternoon. Traffic and weather together on the 8s on KCBS. And we return now to our conversation with Marie Bernard, Executive Director at the Sunnyvale Community Services. And we were talking earlier about the cost of living. You were describing how expensive it is here in the Bay Area, how expensive eggs are, never mind paying the rent. What are some of the things that you're doing to help these people that you identify as being homeless, and how can you prevent them from becoming homeless?
Well, if we could prevent successfully for everybody who needed the help, we would have zero numbers. So that would be a blessing, but it's not necessarily going to happen in our lifetimes. So what we are doing since 1970, we've been around for 55 years now. Our community has come together to help people, and it was originally meant for the occasional speed bump. Someone has a medical bill, they need help with their rent so they can stay housed. Now it's become more of a chronic issue. And so some of our programs, and we helped 11,300 of our neighbors last year, and we distributed $3.8 million of financial assistance just from our own agency. And it was still not enough to keep people housed, to help them with that bridge if they need help with rent, to help them move into housing. Moving into housing might cost 2 months of rent on top of the additional rent that you have to pay. And what we're finding is we're moving people out of Silicon Valley because they can't afford to live here. So sometimes prevention means a move. And other times it means that people need case management, intensive help to help them change the trajectory of their income or move into more affordable housing. But we can only case manage 1 out of 10 people that we help. Today, ironically, we had the point-in-time count starting, people arriving at 5:36 this morning. At 9 o'clock, we started our food distribution for the week, and we're expecting 1,500 families. That's about 3,600 people coming for groceries today. So we are this nonstop hub trying to help people keep ahead of the curve so that they can stay housed. Those folks who are coming to us for food need it because everything else is so expensive. Food becomes a luxury, or they'll forego food or healthy food in order to pay a bill. Car repair bill, medical bill. It could be that they can't pay their DMV license. Even small amounts to some of us are big amounts when people can't afford it. And just keeping ahead of that is a relentless job for those families. They're often working 2 or 3 jobs. And they are folks who are really struggling, and they're the workers here in our community. So many of the folks we encounter are the folks that you'd see at the grocery store. They're the folks who are the workers in so many professions that we have. Many of the care workers who are taking care of our older citizens are folks who are themselves not able to stay housed very well. So I think, unfortunately, unless things shift dramatically about affordability here, we're going to see these numbers, unfortunately, go up, not down.
That is a really sad situation. It's a multifaceted problem when you talk about homelessness. So what percentage of the people who are homeless are, as you described, these working poor versus people who have other types of issues, maybe addiction issues?
Well, I think it's a cause and effect. I think that being homeless tears the heart out of you. I've watched folks, and you can spend half of your day just wondering where you're going to sleep and where you're going to be able to get something to eat. Your whole life changes. We found that when people become unhoused for the first time, which is, a tragic thing that happens, within a couple of months, they lose a lot of the tethers that help them thrive. So they lose access to their paperwork. They have to carry everything around with them or keep it in their car. And so their chances of losing their job go up. Their chances of becoming unwell in any sense, it goes up because this is not a good situation. It's not a healthy situation. So sometimes I think it's cause and effect. But in the data that I've seen, 70% or more of people can be working and still unhoused, at least when they become unhoused.
Yeah,
And the other thing that one of the biggest reasons why people do lose their housing is they're temporarily out of work. They may be laid off, or they had a medical bill, and they couldn't go back to work. And the other tragedy is a lot of jobs in the Bay Area don't have benefits, so they don't have sick time. They don't have paid time off. And so any blip in their employment means that they may be subject to not being able to pay their rent.
It's kind of sad to look around because so many people, any of us could be in a vulnerable situation in many cases. I'm curious about, so people who are living in their cars, living in RVs, those people are also considered homeless. It's not just people on the streets. I want to ask about the prioritizing of housing. When you've got so few spaces, how do you decide who gets to go inside?
Well, we have one program called the Tenant-Based Rental Assistance, which is funded through the city of Sunnyvale, which is a blessing, and it's HUD funded. It's helping 40 families. Those families, all of them were unhoused before they entered the program. And we have to go through a careful screening program because the hope is that within 2 years, these families will be able to afford the rent on their own. And so we give wraparound services to help them improve their income, improve their outcomes, support them in their goals, their life goals, their goals to be self-sufficient. And it's throwing everything we can possibly to help these families succeed. That's only 40 families, but it's a micro view of what it takes. And it does take a village with a lot of support for hardworking families to be able to afford to live in the Bay Area. And we help them find affordable housing. We work with landlords. Part of it is just a relationship that we have to have and we love having with a lot of the local landlords who themselves have to run a business, need the income. And during the pandemic, we were fortunate that we channeled a lot of the funding that came from the federal government and paid the landlords, which meant that they were able to stay above water along with their tenants. So there are systems that can work, but there's a lot of different parts that you have to have. You have to have money. You have to have housing. You have to have the staff or the people that will help with the wraparound services. And you have to connect people to the services that they're entitled to receive. And a lot of them don't even know they're eligible for something. So many of us are daunted when we have to apply for something that's, government grant or something. And you're entitled to get it, but it's really hard to get through the system and to understand how to apply. So expert advice, but also the ability to do that wraparound. And again, we're only able to help a fraction of the people whom we know are qualified and eligible for these programs.
Oh, that is heartbreaking to hear. I want to ask you just a final question. This is a count that happens every 2 years. When are we going to have the results of today's count? Or next 2 days?
Yeah. Well, it'll take a while, I know. And they're going to do the macro as well as the micro. So we'll get the total count in the county as well as by the city and by the areas. It'll take several months. I would give it at least 3 months. And I think that's probably a short amount of time because they have to go through quite a lot of analytics. So stay tuned on that. I think you'll get a pulse of it very soon because people will be coming back and saying, this is how it felt. There is a new methodology this year, so hopefully there'll be even more rich data that we'll be able to glean from all of this that will give more background even on all of this. Sadly, one of the things as I've done the count in the past is seeing how many people are in their cars. That's the sad part. The telltale sign is if you see the windows are fogged up or people have their windows covered, and it could be somebody on your block and you don't even know it.
Marie, we're going to have you back. Will you come back and update us once we get those numbers and talk a little bit more about it?
Perfect. Thank you so
Absolutely.
much for being on top of this. You're doing a great job.
Thank you, and we certainly appreciate your work. That is Marie Bernard, Executive Director at Sunnyvale Community Services. The point-in-time count for homelessness across the United States underway in Santa Clara County right now.